how many mistakes we've seen by employees getting bad advice from their HR departments or their coworkers. There's a lot of questions and answers concerning employer insurance versus Medicare. And it really depends. Everybody hates that when something depends, but pay attention closely. If your employer is 19 or fewer employees, you probably have to activate full Medicare. If you're high income, that's going to be a big charge to you. If you have 20 or more employees at your job, it's probably not going to be required for you to have any sort of Medicare. In fact, if you have a health savings account at work, you don't want to activate any of your Medicare. But if you don't have a health savings account, you can activate Medicare Part A only if you're at a large group, and that's free. That assists your group health plan in case you go to the hospital or the rehab center. Now, I had a case recently where a person called me. He was working at an employer that was a small employer. His wife was working at a small employer. But his employer really was not a small employer. They were subscribing to a large pool called a professional employer organization. Man, this can get really confusing. He was actually part of a large group. She was part of a small group. In that one household, the Medicare rules were different. So call my office instead of trying to figure this out all by yourself. All of our services are free. There's no charge, and we have 10 employees that can help you. But if you'd like to read a flyer that we have on questions and answers that are most common, then you can just download it by clicking the link below. I use this information to retrain human resource department employees who unfortunately have misinformation that they're handing out to their employees.